Okay, we are live. Have a great meeting, everyone.
All right, good afternoon. It's Monday, April 26th. It's 3:01 p.m. and this is the regular meeting of the Lincoln County Board of Commissioners. As has been the custom lately, we're holding this virtually. First item is to call the meeting to order, which I have now done. We have two commissioners present, which does represent a quorum. Commissioner Jacobson is excused today. Next on our agenda, we have two proclamations today. The first proclamation is proclaiming May 7th, 2021 as Children's Mental Health Awareness Day in Lincoln County. I will ask Commissioner Hall to read the proclamation, and then I believe we have Linda Gray with us to provide some comments. So, Commissioner Hall.
Thank you, Chair Hunt. Whereas good mental health is a key component in a child's healthy development, and Children's Mental Health Day provides the opportunity to focus on this important matter while celebrating the accomplishments of children and families affected by mental health concerns. And whereas, according to the United States Department of Health and Human Services, 1 in 5 children is diagnosed with a mental health condition. And whereas research has shown early identification and appropriate treatment of mental health disorders among children and adolescents provide them better opportunities to lead full and productive lives. And whereas children and youth with mental health challenges and their families benefit from access to timely services and supports that are family-driven, youth-guided, and culturally appropriate, they also benefit from the integration of behavioral health in primary care, education, and welfare. And if we could scroll, please. What, too far, sorry. Oh, no, we're good, okay. Whereas children and youth with mental health challenges and their family, okay, yeah, I read that. Whereas it is important that children and adolescents, along with their families and communities, learn about warning disorder and where to obtain necessary assistance and treatment. And whereas obtaining a full and accurate diagnosis of a child requires gathering information from diverse sources, including the family, school, and others involved with the child. Now, therefore, we, the Lincoln County Board of Commissioners, also acting as the local mental health authority, do hereby proclaim May 7, 2021 as Children's Mental Health Awareness Day in Lincoln County. We also call upon all Lincoln County residents, government agencies, faith communities, businesses, schools, and other public and private entities to increase awareness and understanding of children's mental health and suicide prevention, and to learn the steps that everyone can take to protect their and their loved ones' mental health.
All right, thank you, Commissioner Hall. Linda Gray, do you have any comments at this point, or should we go on to the second proclamation and then we can talk about both of them at once? What would your pleasure be?
Well, I would like to go ahead and make a few comments, if I may, and then I'll give the floor to Kristen and her proclamation. I would like to acknowledge that May 7th is Children's Mental Health Awareness Day. And if I may, I'd like to also add that May 10th through the 16th is Children's Mental Health Awareness Week, which didn't get put in there. And the other things I'd like to say is that suicide rate for all ages in 2019 were up. There were 20.4 deaths per 100,000 in the state of Oregon. The 2020 finalized numbers are not in yet, so I'm not able to give those to you. Youth 10 to 24 actually decreased for the first time since 2015, but Oregon still ranked 11th highest in the nation for youth. So, so it will, we'll be able to see what the numbers are, as we go along. Probably in the next month or so, they'll be out. The actual ED visits for youth in our county in 2020 were 99 from the ages of 18 and under. And so far for this year, for 18 and under, the numbers are 42. So I also have some numbers that I would like to put in the chat or maybe email to the board so they can be put out for people to see. There's Lines for Life, there's Youth Line, and then there's one called Safe and Strong, which actually addresses the challenges related to COVID for all ages. So if that's appropriate for me to do, I'd like to do that.
Certainly, I think it's appropriate.
Okay. Okay. So I'll let Kristen have the proclamation. Fine.
Kristen, welcome.
Yes, thank you. So this proclamation is about Mental Health Awareness Month, and I know that several of our mental health promotion team is out there. We're also putting enhanced efforts into mobile crisis right now and responding to calls in the community. We're still seeing a lot of folks between COVID and the wildfires and the usual mental health treatment that happens here in Douglas County or Lincoln County. Sorry. We're still staying very busy. Additionally, we have a large increase in forensic kinds of evaluations in the last year. I think we did 0 in 2018, and last year we did 42. So those are mandated 370 evaluations. So we're staying plenty busy. I think our goal for the next year is going to be to increase serving folks before they go into a mental health crisis in the community. And mental health awareness is the first step of that.
Any other comments from either you or Linda? Commissioner Hall, questions or comments? I'll read the second proclamation, but I thought we'd do questions at this point.
No specific questions for me at this point, but I just really, I've advocated locally and at the state level for improving access to mental health services for a long time. And I'm just glad for any opportunity for us to shed the light on the seriousness and extent of this challenge.
Well, I might add, I think that the county has done several things recently or in the last few years to try to improve our behavioral health services. Certainly one of the things we did was to integrate behavioral health into the federally qualified health center so that when individuals are seeking health care, both the primary care and behavioral health care can be involved at the same time. Commissioner Hall, I continue to give you accolades for your bringing to our attention, the county's attention, the Stepping Up initiative, and I know you worked closely with the sheriff. And of course, that program is designed to try to intervene and take action to prevent the individuals with mental health challenges from being incarcerated. Certainly in jail is not the best place for treatment. So I think many things have been done. I might ask either Linda or Kristen from Douglas County, Lincoln County. I'm teasing you.
It's Monday.
What are some of the other things we've done? And maybe is there a differentiation between services or treatment for youth versus adults?
Yes, there is. Linda has a couple specialty programs going. One of them is wraparound, and the other one is a pilot program called Parent-Child Interaction Therapy, and she can speak more to those. In adult, we have 3 separate branches under mental health. One is the ACT team, which is not quite up to Fidelity, but they're highly intensive case management in the community, trying to keep folks out of residential and higher levels of care. One is the crisis
Can I
team.
just jump in for a sec? I'm sorry to interrupt, but for the public listening, they may not know what the term up to Fidelity means.
Oh, so up to Fidelity means that there's standards that we need to meet to be called a best practices program, things like 24-hour staffing within the team itself, and other kinds of standards. And we have not gotten there quite yet, but we continue to work to get there. In the meantime, that team provides high intensity case management, med management kind of wraparound services. So the other teams we have are the regular adult outpatient therapists and the crisis team. Additionally, there are a lot of state mandates in adult that we've managed to keep covered as well, including forensic stuff, pre-commitment investigations and commitment follow-ups, etc. We're staying really busy. And we're also doing the core COVID grants for the most part with some help from Linda and some other community members.
Right. Yeah, we have case management involved in the core program. So just to add to what Kristen's saying, we have several evidence-based programs in child and family. Kristen mentioned a couple of them, which is wraparound. That's for any child. It's youth-driven. Family voice, youth choice is the kind of mission statement for that. We have parent-child interaction therapy, which is for anywhere from 2 to 7 years old. We also have ESA, which is your Early Assessment and Services Support Alliance. And that's for any youth from the age of about 13 or 14 through 24 who are suffering from a first break in psychosis. And it's a 2-year program with intense services to provide treatment so that hopefully they won't have another break. But there's all kinds of services involved in that, like supportive employment, education, case management, medication services. We also are in all 4 school-based health clinics, and so we provide services to students through the health clinic, and we also have outpatient at our regular clinic services. Currently, we're doing a lot of telehealth, but there are some services that Oregon Health Authority is requiring that we do in person. And that would, like, for instance, like the ESA program for a youth that might be suffering from a first break. We would do an assessment appropriately with the COVID guidelines, of course, but, we would do those services so that we can get a genuine feel for what's going on with that youth.
All right. Any other questions or comments, Commissioner Hall?
Not right now, thanks.
All right, I will read the second resolution, which is proclaiming May 2021 as Mental Health Awareness Month in Lincoln County. Whereas mental health is essential to everyone's overall health and well-being, and whereas all Americans experience times of difficulty and stress in their lives, and whereas mental illnesses are real and prevalent in the United States, and whereas 1 in 5 adults experiences mental health problems in any given year, and such problems can contribute to the onset of a serious mental illness, such as major depression, bipolar disorder, or schizophrenia, and whereas 1 in 10 adults lives with a serious mental illness, and an estimated 2 million adults with serious mental illnesses are in jails, and whereas 1/2 of those with a serious mental illness began showing symptoms by the age of 14 and 3/4 by age 24, and life expectancy among those with serious mental illness is 10 years less than those without this illness, And whereas suicide is the 10th leading cause of death in the United States, and 90% of those who die by suicide have an underlying mental illness. And whereas in Lincoln County, suicide is the 7th leading cause of death for adults, and nearly 21% of 8th graders and 18% of 11th graders have considered suicide, which to me is just frightening. That was my editorial comment. And whereas with early detection and effective supportive treatment, individuals within mental illness can have recovery and lead full, productive lives. Whereas public education and community support activities can encourage emotional and mental health and help improve the lives of individuals and families affected by mental illness. And whereas prevention and early intervention, including mental health first aid, are effective ways to reduce the incidence of mental illness and suicide. And whereas the U.S. Surgeon General's National Prevention Strategy has recognized mental and emotional well-being as essential for all Americans, with a plan for action that all Americans use to better handle challenges and protect their mental health. Now, therefore, we, the Lincoln County Board of Commissioners, also acting as the local mental health authority, do hereby proclaim the month of May 2021 as Mental Health Awareness Month in Lincoln County. We also call upon all Lincoln County residents, government agencies, faith communities, businesses, schools, and other public and private entities to increase awareness and understanding of mental health and suicide prevention, to learn the steps that everyone can take to prevent their and their loved ones' mental health, and to get involved in the community resource of mental health first aid. All right, anything that either of you ladies would like to add? All right, Commissioner Hall, I'll entertain a motion.
Okay, can we go back to the main agenda, please? So just phrase
I'll tell you
it.
what, I'll help you out. I'll entertain a motion
Okay,
to approve the resolution proclaiming May 11th, 2021 as Children's Mental Health Awareness Day in Lincoln County. I'll move.
Okay, the agenda says May 7th.
Right, that's correct.
Okay. Okay, so
I said
I
something
will,
wrong, I'm sorry. Proclaiming May 7th.
okay, I will second that motion.
All right, any other discussion? All those in favor say aye. Aye.
Aye.
All right. I'll also move to approve the resolution proclaiming May 2021 as Mental Health Awareness Month in Lincoln County.
I will so move.
I'll second.
Could I ask,
All those-
could I
Go
ask
ahead,
a
Linda.
question?
Please.
Could we do the Children's Mental Health Awareness Week also? That would be May 10th through 16th.
I see no reason we couldn't, but I will seek, I guess, advice from Council Belmont.
Thank you. It just was not put on the proclamation, sorry.
Yeah, my only question, I mean, I'm certainly supportive of recognizing it, and I know Mr. Belmont will weigh in, but I'm not sure how we can do a resolution if we don't have a text.
Yeah, and I guess
Okay.
that's my question, Linda. Is there an actual resolution for that? If not, if you simply want a motion to proclaim those specific dates as Mental Health Awareness Week, the board could do that right now and just simply do that without a resolution, but it would be officially on the records.
If that's acceptable, I'm happy to make that motion, Mr. Chair and Linda.
Thank
Please.
you.
Please do so.
I am making that motion right now to recognize Children's Mental Health Awareness Week.
Which is, just so we're all clear, which days, Linda?
So the Children's Mental Health Awareness Day was May 7th, but there's a Children's Mental Health Awareness Week, which is May 10th through the 16th.
Okay, so.
I don't know why they complicate it like that.
Well, it's okay. I just want to make sure we have the dates. So we're proclaiming May 10th through May 16th as Children's Mental Health Awareness Week. Correct? All right. I'll second that motion if you're comfortable with it, Commissioner Hall.
Yes.
All right. Any other discussion? All right. All those in favor say aye. Aye.
Aye.
All right. And I believe we've now done the two resolutions and then the additional proclamation. Anything else? All right. Thank you, ladies. Keep up the good work and please share. I know both Commissioner Hall and I sincerely appreciate the hard work of all of our behavioral health staff in these unusually challenging times. So thank you and please keep up the good work.
Thank you.
All right, we will move on. Next item on the agenda is the adoption of the consent calendar. These are items of a routine nature or items that have come before the board previously. At this time, I am going to highlight the item B, which is a change in the membership of the Budget Committee. With this order, we are appointing Susan Woodruff, who is former Mayor of Walport, current City Council member of Walport, a longtime resident in South County. And I have been on the County Budget Committee in one form or another since I believe 2006, first as a private community representative and then as a commissioner. And in all that time, I don't remember anyone being on the Budget Committee from South County. So I'm very pleased to be able to appoint Susan to the Budget Committee as a representative from South County. With that, is there anything else, Commissioner Hall, you would like to highlight?
Nope, I'm willing to make a motion for adoption of the consent calendar as presented.
And I will second it. All those in favor say aye.
Aye.
All right, we have adopted the consent calendar. Thank you. All right, next item on the agenda would be a decision action item. This would be a resolution approving the taxation and assessment grant that was presented to our board last week by the County Assessor Joe Davidson. Any comments from Council Belmont? Otherwise, I believe this is fairly routine.
It is, and you have the appropriate documentation in front of you to adopt today.
Okay. Commissioner Hall.
No further comments or questions. I'd be happy to make a motion to adopt resolution 2126-4 2021 CAFFA grant submission.
I'll second it. Any other discussion? All those in favor say aye. Aye.
Aye.
All right. We have approved that grant submission. Thank you to Mr. Davidson. Appreciate all his hard work. All right, we'll move on to reports, and we're now ready for the Lincoln County Public Health COVID-19 update. Normally, this would be presented by our interim Public Health Director, Florence Portal, but she is unavailable today, but we have very capably in her absence, our Public Information Director from the Health and Human Services side, Susan Traxel. Susan, tell us what's happening now in the world of the COVID pandemic.
Thank you. Thank you, Commissioners. I'm happy I've now been promoted to Director, which is not quite what I am, but that's okay. I work on communications for the County Health Department and then assist with emergencies. What we've got today for you is a fairly long update. You can see it's 24 pages long. So I'll try to go through it as quick as I can, but thorough so that you can ask questions on what's going on. Next slide, please. Okay, so you can see so far in the month of April, this is through Sunday, we have 119 cases in Lincoln County. We are approaching November levels. It depends on how the next few days go, but we could meet or surpass our November COVID cases. Next slide, please. The county risk level, we are at high. You'll notice over on the far right, for the last 2-week period, we have decreased. This is really good news. We're down to 128.5 cases per 100,000. So, I mean, we're even getting closer to the moderate level. So depending on how this next week goes, it is possible that we could drop down to moderate. It just depends on how many cases we have in the coming week. So that's a good sign. Other counties in the state are not quite so lucky. There's maybe 17 that could be going into high risk this week. But we won't know officially, I think, until tomorrow. Next slide, please. Okay, that doesn't fit very well. Sorry about that. So the hospitalizations and deaths are definitely trending up. You can see that I mentioned we're going to stay in high risk, but what's new this week is the governor last Friday said that if counties would meet the extreme level this week, she's stopping the waiting list because of the high increase in cases. So just this morning, we got an email that said the hospital beds metric was met. This is a metric that has to happen in order to trigger that extreme risk level for any counties that fit it. We have not heard official word on which counties that may affect or if she is going to officially limit the waiting week. It could be in the mail now. I don't know. But the peak daily number of beds occupied by patients was 319. The limit is 300. So once you hit 300, that starts to trigger it. But you also have to have a change in hospitalizations of 15% or more. And we in the state had 37.4% change in hospitalizations over the prior 7-day period. That's concerning. You know, most of those are in the Tri-County area in Portland, but there's even some smaller counties that have seen quite the spike in hospitalizations and cases.
Susan, if I may ask a question, and I don't mean to put you on the spot, but my understanding is that part of the rationale behind the governor's decision to make this change is the fact that really the hospital beds aren't hospital by hospital allocated. It's really on a statewide basis. So if the Portland metropolitan area hospitals run out of beds, or really more specifically ventilation equipment, as I understand it, that will result in sick individuals that require those services going to hospitals outside of the Portland area, which is why there's this concern that when the state reaches a certain level of beds being occupied, that it really triggers the higher action level, if you will, for the risk levels of counties. Is that a fair summation?
Yes. What happens is hospitals will have to start reducing their other patients. So for routine surgeries or things like that, they won't be able to do those. And when you're talking about that highest level of care, it's called ECHO. I don't know what it stands for because that's not my specialty, but what we're told is that there's only a few hospitals that can do that, and they're at risk of running out of those services in the state. And if they do have them, it's possible people who need that highest level of care could have to move to another hospital. So that's, you know, every time you move, it's a risk. And so that's the concern. We've had higher hospital rates in the state before, higher than 300. And that was during our last surge. The increase over this time, remember, this is a couple weeks after infections that you start seeing these hospitals increase. We're seeing it continue. And so the concern is that if we don't take action now, it will rise even further which can make people with other medical conditions be at risk for extreme illness or fatalities if it got worse. So we're at the point where we can stop it, but we've got some things we got to do to make that happen.
Commissioner Hall, I see you have a comment or a question.
Yeah, just Susan, if you could maybe help me refresh my memory, but I'm thinking back to things we heard in briefings in the early stages of the pandemic. The point that Commissioner Hunt made was true, but also kind of it can flow both ways, if I'm remembering correctly, that, you know, we've got two great hospitals here in Lincoln County, but again, their capacity for handling what might be, I guess, more complex cases with multiple complications that some, you know, they might not be able to manage the situation properly here, and they might have to go to a metro area hospital for the more complex types of care as well, right? So the point I remember was, you know, emphasizing that we really have to think of the state, all hospitals in the state, as a single system. You can't just look at the capacity in one area.
That's right. They look at regional hospital capacity, so that's generally where you try to do your transfers is within that region. But then sometimes you have to go even further because they might be on a redirect at a hospital and say we can't take any patients. So we're not at that level yet. That's the good news. We're at the warning stage where we might be triggering some extreme risk reductions in some counties, not in Lincoln, but we have to be aware of what's happening in other counties because people do come to Lincoln County, and we need to not relax our guard here and keep ourselves below that level so we don't have people going into the hospital that have to transfer. Yeah. If there's no more questions, I'll move on to the next slide.
I think you're moving on is good.
Okay, so variants. We've talked about this the last two presentations. I've highlighted the B117 variant, which is from the first discovered in the United Kingdom. Last week it was 69 cases in Oregon, and now it's 112. That's the biggest increase in variants in the state over the last week. Again, these were samples pulled maybe 2 to 3 weeks before, because it takes that much time to do genome sequencing. And then we, in our region, our 6-county region, had 8 more B117. This is very concerning if it continues to increase because that is a much more transmissible virus, and it has some increased severity, especially in the younger people. It's really traveling through there. That's what they saw in the UK, was it's being transmitted across younger people, and then they were also getting very sick. So we're keeping our eye on that, and we'll keep updating you as that changes.
Susan, Doug again. Is there any evidence as to the B117 variant being it's more transmissible, but I guess my question is, do face masks and social distancing and hand washing, are those still highly effective in preventing the spread, or does it spread more readily even with the those practices?
Well, 50% more transmissible would mean that if normally there'd be 100 cases, there might be 50 additional ones. You still have to do those precautions because they will work. All of those masking, hand washing, and physical distancing will work to prevent the spread. What's difficult is it can spread easier. So just even a little bit of a relaxation of your precaution can cause the spread to happen and more people will get infected. So that's really why we're looking at it, and also the increased severity that appears to be happening with this particular variant of the virus. But yes, we have to keep doing all of those precautions to further cut down our chances of spreading that virus.
Very good answer to a poorly worded question. Thank you.
Okay, next slide, please. Thank you. Okay, so vaccination trends. I'm not sure why this doesn't all fit on the screen. In
Casey, can you shrink the size of that image? There we go.
Okay. So, in Lincoln County, we've dropped a little bit in our vaccination rates. We're now number 2 behind Benton County. But it's really, really close. And it's really good news that a county right next to us is also doing a great job with vaccinations. So we've got a little over 50% of our entire population vaccinated now, and almost 60% of our 16 and older, which is wonderful. We are seeing a slowdown, though, in our vaccination rates, and I'll talk about that in future slides. But you can kind of see on that one little bar chart, it's starting to kind of flatten out and slow down. So we're keeping a pretty close eye on that and seeing how we can increase the uptake of our vaccination. Next slide, please. Thank you. So testing, this is our testing for Lincoln County. I know there's been some questions about how many people are we testing, and you know, are we doing more testing? We are doing a little bit more than, you know, back in March, early March, we didn't have as many testing, and that was last year, I'm sorry. So like last fall, we're up past last fall levels, but we're not quite to the same levels of testing when we had that larger surge in December and January. But we are seeing people tested, and our positivity rate is about 5.5%, I think is what that says. On that, in the PDF version that is uploaded here and that will be on the website, when you click on this graph, it will take you right there to the original graph, and you can play around with seeing what those numbers are. So next slide, please. The big question is, why are the cases increasing? What we're seeing is that even though we're doing really well with vaccinations in Lincoln County and have been for a while, that doesn't mean it's the same situation in other counties or other states. So it's a whole community effort, a whole state effort, a whole country, and a whole world effort. So until we can get the same numbers in other places that are our level, we're still at risk of transmitting this virus to other people. We're coming into tourism season, have been in tourism season, so we're seeing more and more people come over. Our goal is to encourage people to continue with those prevention measures like masking up, etc. Spring break, we think, was a contributor. We're seeing more cases in young people, and in fact, it's in hospitalizations, they're trending lower in the hospital, and almost all of them were not vaccinated that went to the hospital. And then these variants are more transmissible, so that's going to drive the cases to increase. Next slide. So I just want to make sure everyone saw this quote from Governor Brown last Friday. She was talking about we're like in this race between vaccines and variants. And the only way to really get this stopped is to get the vaccinations into people. You can only do so much with your prevention measures. We all get tired of them. People start getting relaxed. You haven't seen a case in your family and you start thinking it's okay. But we still have to keep doing those, and we need to vaccinate as many people as possible. Next slide, please. So these next few slides are a little bit wordy. I'll just go over the general idea here, and then if you want to read it further in the public, it'll be on the website. Something new is that OHA is recommending a 14-day quarantine for all unvaccinated contacts in all settings. There were some situations where you would have to quarantine, like in healthcare. If you were a contact, you wouldn't have to quarantine unless you were sick. But now they're changing that because they're seeing this spread of the virus increase so quickly. Everyone needs to vaccinate unless they have some kind of employee shortage at let's say, a hospital or something like that. But if you have been vaccinated and it's 2 weeks after your last vaccine that finished your series, you can avoid quarantine if you get exposed unless you develop symptoms. It's another really good reason to get vaccinated is because if you do get in touch with someone who has the virus and you're not sick, you can still go to work and not lose your money from your work. You can still go to the things you wanted to go to safely, as long as you remain asymptomatic. Next slide. Okay, the Johnson & Johnson vaccine. Everybody wants to know what's going on with that. So this last weekend, Oregon approved the resumption of the use of that vaccine. And what's added now is a warning about thrombocytopenia, I think. I'm not a medical professional, so those are hard for me. And you have to present that in a way they understand. So thrombosis is blood clots in your body, coagulation of blood in your cardiovascular system. And then thrombocytopenia is the low platelets. So that's the syndrome that has been happening in a very, very tiny number of people, but because it has happened, and actually someone in Oregon did die from this last week, they're adding that warning label. So there are links to the fact sheets, and I have more information on the next slide.
Susan, would it be fair to say that when you look at the side effects or adverse reaction to the Johnson & Johnson vaccine, it's really not out of the ordinary in that every medical procedure has some risk and there are some adverse effects or reactions. So while it's tragic, in the world of medicine, I guess I would say it's not unprecedented.
It's not, but it is very concerning for people who are getting the Johnson & Johnson. So that's why we're wanting to make sure that people know exactly the details behind the risk so they can make an informed decision. You can see right here, this slide is just describing the cases that we already know about. There's been 15 so far, and all were women. And if you go to the next slide, I talk a little bit more about what that risk ended up being after this evaluation by the FDA, CDC, and then the Western states. So it was the risk is 7 per million doses in women 50 or younger. So 7 out of every million Johnson & Johnson vaccines might develop this TTS syndrome, this blood clot and low platelet syndrome. And that's just based on the cases that they reviewed. If you're older than 50, it drops down to 0.9, so it's even more rare if you're over the age of 50. And then apparently in the study, there was also one man who was identified in the study that had this syndrome, but none in the actual vaccination effort recently. So those are the risks that happen. It's very minute, but it is enough to, cause us to stop, look at that, and make sure you know about those risks. So what we're doing here in Lincoln, they're working on getting us the translated fact sheets, and we will be getting that information out in plain language so people understand what they're getting. It is still an excellent vaccine. It's still great. It has a great result. It's really a very minutely low risk, but we want to make sure people know those risks. Okay. Any other questions on that?
Mr. Chair?
Go ahead, Commissioner Hall.
Thank you. And just another factor I see in this, that even though the risk is extremely low and, that this is an abundance of caution and proper communication, but, one of the unfortunate facts is there is still a significant vocal minority of the population that just is suspicious or downright resistance to being vaccinated. And unfortunately, the possibility, the publicity around these small number of cases seems to feed into the rumor mongering and fear. So I'm glad that there's going to be an aggressive effort to get the truth out.
Right.
Thank you.
And
Thank
we
you,
look at the
Commissioner.
data. So the data points to it being very rare. We look at population health and do the benefits outweigh the risks, and they really do. Getting the vaccine prevents hospitalization and death far more than they cause these side effects. But it's really an individual decision. There's two others that people can pick from. So it's not that you don't have options.
No, and I think that's an important point to emphasize, and frankly, that's what I was trying to get at earlier. Certainly, we don't want anyone to suffer an adverse reaction, but when you look at the statistics of the risk of an adverse reaction from the vaccine versus the risk to your life by driving a car, the car's a lot higher risk, and that to me is, at least to me, that helps put things in perspective.
That's true. There was also a question about how many staff we've had dedicated to the pandemic. You can see we've brought on over 20 investigators and contact tracers, and between 15 and 20 for the vaccination efforts for the pandemic. And we have 4 nurses that came out of retirement and agreed to work for our communicable disease team for a year, which is wonderful. And if you go to the next slide, you'll see how amazing our volunteers have been. We've had 394 volunteers, including county staff that went over there, people who have worked with different organizations, or people who just signed up to volunteer and went through our background check and training. And they've done over 6,500 hours of volunteering since January 20th. This is only for the clinics we do at the Commons in Newport, Walport, and then the yacht club events we had. This doesn't count anyone who's helping out at Samaritan, or if they're helping with tasks, because they organize all of their own people to work that. So lots and lots of work done by volunteers. There is no way we could be where we're at without the hard work of these people. Next slide, please.
Before we move on, if I could, Mr. Chair. Oh,
Please do.
thank you for those numbers, Susan. I think I had, in an email to Florence at the end of last week, requested if these would be available. And, even though I knew we had brought in large number, as well as the additional staff resources, large numbers of community volunteers, but those figures on number of individuals and number of hours is, it's just truly outstanding. And as we continue to do, a big salute to all these people for making it possible to put up the outstanding numbers that we have.
Well said.
Thank you. Thank you. And so, we're continuing to do more outreach in different ways. So this week, there are a couple of small clinics geared towards certain populations. So Olala Center is working with the First Baptist Church, and they are targeting the people from the Guatemalan community. So, people who don't speak English or Spanish, they speak a different language from Guatemala and the Mayan indigenous peoples. And then also LGBTQ, they're working with a partner who's also going to do outreach to those populations. So you won't see those on our website because these are partners who are doing their own outreach, and we're just supplying them with assistance as they need or helping them find the vaccine. And then this Friday, we're doing our very first mobile clinic with the Samaritan bus. Amy Snyder has been working a lot on doing this work, and next Friday, 3 to 7, there's going to be a mobile clinic at the Yachats Commons. It is on our website, so you can sign up for this. They really would like to have all of their residents in the Yachats area sign up. So if you live there, please go sign up. And they'll take walk-ins. All of our clinics will take walk-ins now. And when we do get the plain language stuff for the Johnson & Johnson, we've got some people in the jail that need the vaccine, and finishing up some of the outreach to people who are stuck at home. Next slide, please. I'm talking too long. I'm sorry. I'll hurry up here. Businesses and organizations. Again, Amy Snyder has done a ton of work. She's been in communication with a variety of businesses and planning for little pop-up clinics where they're at to try and bring the vaccine to workers so they don't have to miss work, and or businesses don't have to worry about paying for time off or any other reason why people can't get to the vaccine. So we're going to try and take them there. If there is a business or organization that wants to be involved in this, you'll see the link. That's a little survey, and it goes straight to Amy, and she'll be in contact with you to talk about what we can do.
And that link, I assume, is also on the county website.
It is not. It'll be on here. It's not a one that she had me put on the website. I'll check with her and see if she'd like to do that. And if so, it'll be on our vaccination page is where I would put it.
All right, very good.
So communications, here's what we're doing for comms. We are revamping and updating our Keep Lincoln County Open campaign from last year. And we're changing it to mask up, wash up, back up, and backs up. So if you want to participate, we're doing hashtag backs up Lincoln. We're also putting some other things on our Facebook page and through other media. If you scroll to the next page, you'll see that we are partnering with Samaritan for a Healthy Tomorrows campaign. So an example there, that's an example of a potential billboard we might be putting out. We'll also be adding our Lincoln County Public Health logo because it's just Samaritan and Lincoln County partnering on this. And we're asking for leaders in the community or anyone in the community, because we're all leaders in our own way, to share why you got vaccinated or what you're looking forward to after you get vaccinated. We have already received many submissions from a lot of people, so you'll be seeing that coming out through our social media. We're also working on radio, like I said, the billboards, some print ads and things like that. And then finally, after many revisions that were forced upon us as things changed and the vaccine rolled every week, we finally have a mailer that will not be wrong when it finally gets to your mailbox. So we've got a mailer going out to the whole county, every residence, every PO box. You should see them hopefully this week. They'll be in your box. It's going to tell you where you can go to schedule your appointment, who you can call, and why you should consider getting a COVID-19 vaccine. So hopefully that'll help answer all the questions for people who still aren't sure exactly how to get a vaccine, or they think we're still on using the wait list. I have heard that there's been people here and there that think the wait list is still in place. It is not. You just go schedule yourself. No one's going to call you unless you call and leave us your name and you want to call back. So we've done a lot of outreach to everyone on that old list, but I think people are still struggling getting all the info. So hopefully this will clear that up. And then the last thing I have is our vaccinations at clinics. So we have much fewer vaccines coming in this week, but we do have quite a bit on hand. We have seen the clinics really reduce in occupancy. We just don't have enough people signing up for our mass vaccination clinics. So we are pivoting our strategy towards more of the mobile small clinic methods. So Samaritan's still having their clinics on Friday and Saturday. We've still got a TAF clinic this week on Saturday. We had to cancel the TAF clinic for tomorrow because there were only 17 people signed up. So it's just not something that people are looking for right now. We think that we've hit the stage where we've got everyone who will go anywhere for a vaccine, but they're still not sure, or they'll go if it's near them, then they'll get the vaccine. So we're trying to do some more outreach to those groups of people. And then we have only a few booster clinics this week. A little bit of vaccine came in. And then the second to last slide is the clinics we have this week. You'll notice that we have no first dose clinic in Newport. We don't have them scheduled at all. We just are not filling them up. So, and TAF reduced by 1. And we're no longer going to have those Walport clinics sponsored by PAC West. If we do have one, it will be someone else that will be doing that clinic. And there you go. That was a long report. I'm sorry, but there were lots of questions this week.
If I may jump in,
Good
Mr. Chair.
Go
I'm
ahead.
sorry. Yeah, I just wanted to say, Susan, absolutely no apologies are called for. This is very good, very comprehensive information. And, you know, among the many praises I hear, you know, of course, we're never going to have universal satisfaction over the way we're dealing with this or any issue. But, you know, I continue to hear lots of praise about the way the clinics are being operated, and also very, very high praise about our communication and outreach efforts, especially from people who also spend time in nearby counties, which I won't name, but they tell me, boy, Lincoln County is way ahead of the game compared to some other counties. So kudos. And I'll just add also, Mr. Chair, I was able to ask the questions I had along the way, so I don't think I've got anything further at this point.
Well, I would certainly echo your comments. I think I interrupted Susan many times along the way, so my questions have been answered. But I think if there's one statistic that speaks to the outstanding job that's been done by, you know, our county's public health, our partners, and other entities, organizations, volunteers throughout the state, is the fact that we've been number one, we're number two, which when you look at 36 counties, that's doing extraordinarily well. So thank you, and do not apologize for that presentation. It was all valuable information.
Well, you might be hearing from me again next week, so I will take your kind words back to the team. Thank you.
Well, we'll look forward to the presentation next week, regardless of who the spokesperson is. But thank you again for the good work.
Oh, and
All right.
Casey is showing another attachment about the risk levels, so you can find more details here about the risk levels, and it's on the Board of Commissioners page.
And we should have information from OHA, Oregon Health Authority, tomorrow or later today or tomorrow morning as to if our county status is changing. So, all right. Next we have Echo Mountain fire update. Council Belmont or Director Kenyon?
This is Wayne Belmont County Council, and I have 3 items I'd like to highlight today in the update on the Echo Mountain Complex fire. And actually just keeping in line with the things you've been hearing all meeting long so far. So the first thing is the declaration of Mental Health Awareness Month. I thought I'd update you on the activities of CORE, which is Community Outreach and Recovery Education, and their efforts on wildfire. And that's Shelby Houston at Behavioral Health and her team. And her latest report to us indicates that they've begun creating the content for mental health and resource training that they'll actually provide to the volunteers and staff at the Salmon River Grange, which is in the heart of the impacted area up there. They have been responding to community referrals. They do a weekly outreach at the Grange itself for survivors. They're offering a virtual coping skills group. And they're actually, I think this is really important, try and get more information out, and I'll call on Casey Miller to assist with this. But they're going to plan an event for the upcoming anniversary in collaboration with the Lincoln County School District of the actual fire event itself. Recognizing this is a difficult time for folks as they remember what happened not quite a year, or almost a year ago. They also are working with us over here at the Commissioner's office on a plan to make sure that this CORE model is sustainable and that there's a structure that CORE can continue on to provide services to survivors. Again, in keeping with the theme of what you heard today, one of the outreach events that occurred for wildfire victims there was a special vaccine event actually held at the Salmon River Grange. And that was a great success. I don't have the exact number of how many shots were given, but it was quite, they characterized it as quite a success. And they're going to plan an additional event. That was a Johnson & Johnson one and done event. So it will depend on when Johnson & Johnson, again, is available, when they've done the work they need to do to get the plain language information available. But that will be an additional event coming forward. The third thing I wanted to report on is that we do actually have some statistics on the recovery activities. And this is just a really broad snapshot. It is unofficial records at this point, but it's provided by the Lincoln County Department of Planning and Development on the types of permits that have actually occurred within the impacted area. And to this point, and if you recall, there was 300 impacted properties in the wildfire area. They've actually opened up 110 on-site authorization permits, and that's the septic kinds of permits. They've provided 15 residential structure permits, 2 commercial structure permits, and they've looked at 165 residential manufactured dwelling permits. So that's just a quick snapshot that there's a lot of activity that is occurring in that particular impacted area.
Mr. Chair, I'm sorry, Mr.
Commissioner
Bell,
Hall.
for the interruption, but those numbers, I had contacted Planning Director Anno Husing last week, just wondering if I could get a picture of where things were heading. And I imagine everybody would agree when you can consider that we're just coming out of a very wet winter. The cleanup is just really in its final stages. Considering those factors, and you know that just folks need some time essentially to process the shock of losing their homes. When you put all that together, I just think those numbers are spectacular.
They are, and you know, while they don't represent obviously all the properties that are impacted in the area, it's a substantial start. And so we'll keep you posted on what's occurring there. And I think I'll try and invite Director Husing to come to one of your next meetings and maybe talk about that in more detail, what's occurring. And then the last thing I wanted to talk about is on the direct housing front. You know, if you may recall, the Logan Road site was originally set up with, and they were kind of going back and forth between 18 to 20 or 21 particular sites out there, and settled on finally 19. But my understanding from the latest update we had from FEMA is that they are looking at expanding that to up to 23 potential sites, because they have some more demand. As we sort of anticipated that situations would change, people who may not have needed the direct housing assistance are now in a different situation and do need that direct housing assistance. So it's nice to hear that there is some flexibility built into that program and that we can provide additional assistance to more survivors. And with that, I'll turn it over to Director Kenyon, and he can give you an update on any of the cleanup activities.
Thank you.
Kenyon.
Good afternoon, commissioners. As you can imagine, we are winding down to the cleanup effort. This week, from what I understand, K&E will be working on the remainder of the 15 or so ROEs that came in just recently. The hope is to have those cleaned up here sometime either by the end of the week or next week. After that, I know that there's going to be some other efforts kind of geared more towards some road improvements possibly, and some other things that are in the works. Nothing's been decided yet. It's all basically trying to figure out how we're going to go about doing that. But anyway, that's really about the extent of it. I checked in with Paul Seitz, the solid waste district manager, and it sounds like all of the little issues that we were having, that's all been worked out. And so things are looking up. And like I said, we're nearing the end of this part of the process, the debris cleanup process.
All right. Thank you, Director Kenyon. Council Belmont, Commissioner Hall.
Just something else I might add on the housing front. As you know, I'm a board member of Northwest Coastal Housing, the local nonprofit that received the grant to convert a 41 unit motel in Lincoln City for fire housing. And there is no firm date yet when that will be available for people, but I can update, they need to hire about half a dozen people for maintenance, front desk, staffing, security, and case management. And several of those positions have been filled, and the candidates for the others have been narrowed, but no firm date. But the opening of that facility is getting closer as well.
All right, very good information. And again, I think I would emphasize the fact that if you're a property owner and you're interested in having the debris cleared from your property, the window is getting short, but there's still an opportunity to complete those ROEs, right of entry, so that the ODOT, the state, can clean up. So ending that phase of the challenge, certainly housing continues to be not only, well, I think short term, maybe we've done a pretty good job, but intermediate to long term is where our focus needs to be and will continue to be. So lots of work to do, but progress being made. All right, if there's nothing else on the Echo Mountain fire, next item would be commissioner reports. Commissioner Hall.
I've got nothing additional to share today. Thanks, Mr. Chair.
You're welcome. I'm just going to share some comments that were shared with the governor's Workforce Investment Board. I sit on that board. I'm also a member of the executive committee. And last Thursday, the executive committee heard some information from the Labor Department, Employment Department, about the difficulties in finding employees. And I thought there was some information that was interesting and of value. We're getting to the point where the difficulty in finding employees is not significantly different than the challenges that were present prior to COVID. The reality is that unemployment from an economist standpoint, full employment is generally considered to be somewhere in the neighborhood of 4.5%, 5%. And we were down below 4% prior to COVID. So the challenges in finding employees are not new, but continue to be a factor. The businesses report the difficulty in filling positions, again, is similar to what was being experienced prior to COVID. Some of the other factors, though, that continue to make it a challenge is certainly childcare and the status of our schools. When the schools are fully reopened and fully operational, childcare will return to a more normal status, and therefore may help address the availability of employees. The state is mapping up some new messaging programs to get people to go to the job workforce centers. They're also doing innovative in that they're having drive-in employment fairs, which reminded me of Einstein's theory of insanity. If you keep doing the same thing over and over and expect different results, that's insanity. So the state is saying maybe instead of holding these job fairs in big cavernous event centers, we do a drive-up job fair, and they've held a couple and consider them to be successful. So I think that would really cover the primary facts that I learned or information I learned. Again, with a changing economy and the impact that COVID has had on our economy, the state is looking at some new job training programs, and that would dovetail with the Regional Workforce Board that I also oversee. So some information on the challenge in finding employees in today's environment. So that would conclude my report. Next item would be public comment. Christy, can you show us what we've got there? And these would be public comment that we've received since our meeting last week. And then we also have the site on the web. Can you go to that, Christy, that shows the consolidated information for STRs? And there would be the consolidated report for the week through 1 o'clock today or thereabouts. All right. If there's no more business to come before the board, our next meeting of the Lincoln County Board of Commissioners will be on Monday. I'm looking for my notes. Where to go? There they are. Next meeting of the Lincoln County Board of Commissioners will be held on Monday, May 3rd at 3 p.m. That will be a virtual meeting. And on Tuesday, May 4th, we will have the first Lincoln County Budget Committee meeting. That will also be held virtually at 6 p.m. And the format for the Budget Committee will be the same as for the Board of Commissioner meetings, as far as being able to view the process just as you're able to do with the Board of Commissioner meeting. And with that, if there's no more business until Monday, May 3rd at 3 p.m., we are adjourned. Thank you all.